Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Segmental Scruples edition and all series. This audio podcast is part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, sort of an overview in around looking at sort of the literature or the literature review aspects of the sort of literature review aspects of sort of in around this as part of this sort of series. So to begin with, sort of the aims and justification around sort of a literature review. So the aim or the justification for a literature review which had been carried out over a 38 year duration, looking at a literature around over a 38-year duration when sort of drafted works was sort of put together, and is number one was to understand what further aspects of care are required for patients or recipients with long-standing conditions and/or chronic illnesses. Number two, to highlight what specific practices would help in the development of transfusion care guidelines. And number three, to provide a further understanding of treatment alternatives, taking into consideration renal insufficiency, taking into consideration renal insufficiency. So in around sort of the methodology aspects of this literature review. Um, so initially, a PubMed database or search was carried out, whereby general terminologies such as, for example, blood transfusion, anemia intervention, and renal disease were inserted into the database, into the search engine. And the there were three distinct sort of bases around sort of the arranging of the term of sort of terminologies. Number one was blood and care. Number two was renal health and care. And three was leadership management and care. And and the works highlights the work the work sort of also highlights a number of abstracts or articles that establish relating or regarding to these three sort of categories. And in following additionally, three specific PubMed searches were also carried out, and which yes, three specific PubMed database searches were carried out, and where the strategies around sort of an additional PubMed search included: number one, a basic search; number two, an advanced search; and number three, a refined search. And the reason for carrying out three types of searches was to identify the most specific literature surrounding the review. Now, second to this was an EBSCO host database search, and where a range of databases using the EBSCO host engine over a 38 year duration was implemented to carry out this search. Databases accessed using EBSCOhost included Signal Plus with full text review, and where databases were searched between 1997 up to 2015. Psychology and behavioral sciences collection between 1997, databases access using EBSCOhost included Signal Plus with a full text review from 1977 to 2015. Psychology and behavioral sciences collection between literature between 1977 to 2015. Site info between 1977 to 2015. Health source nursing academic edition from 1977 to 2015. International bibliography of the social sciences from 1977 to 2015, and an explicit but basic coding process was utilized to ensure the terminologies related to categories had also been part of this works. And searching also included smart text searching, which was utilized to replace sort of and or methodology. Smart texting also allowed as much text to be entered for a search, and this included phrases and sentences, paragraphs, and or even whole pages. In addition, options had been selected for full text, peer-reviewed journals, periodicals, and abstracts available within the English language, and amongst works at sort of population, looking at works in around population sort of level. So in around sort of the literature review and sort of the analysis and the synthesis of literature. So in the analysis of literature, a critical appraisal skills program, or CASP, was implemented, and using this CASP, papers were initially classified based on investigations. So again, for example, qualitative works around qualitative research, quantitative research, systematic reviews, randomized controlled trials, interventional cohort studies, case-controlled and diagnostic studies, and diagnostic test investigations and or studies. And 450 abstracts went under a 10-question screening process. The CASP, or Critical Appraisal Skills Program, helped analyze in the following. Number one, to help to gain understanding around whether a study or investigation was valid. Number two, what were the to find out sort of what the results would be. Number three, would the results help locally? Would they help locally? And the CASP 10 question screening process is and was designed to help think about issues systematically. A number of prompts are given after each question, and these were designed to remind why the question was important. So in around sort of the decisions following the searches and around this literature review, overall a total of 141 abstracts through PubMed search engine, and 196 through EBSCOhost databases had been initially sought. And after removal of duplicates, 274 abstracts were subjected to inclusion and exclusion criteria. And in the synthesis of of the 274 abstracts, 82 papers were evaluated, which helped to derive themes. So in around the sort of the drafted sort of works, in around the sort of drafted works, a little bit around sort of a little bit around the sort of around the sort of general grouping of terminologies through the database through the databases. So terminologies were initially in three categories, amongst three categories. So it had a category around blood, a category around renal, and a category around leadership and management. Now, under blood, there were terminologies such as blood transfusion, red blood cells, blood replacement, erythropoietin, hemoglobin, anemia, hemorrhage, intervention, and pharmacotherapy. In and around renal, there was disease, terminology such as disease, chronic illness, renal, long-term, surgery, healthcare, and condition, and sort of medication. And in around leadership and management, there was terminologies such as leadership, management, framework, guidelines, best practice, and research. Now, in around the sort of papers identified through PubMed, under blood, under the blood category, a combination of terminologies of blood as highlighted. This initially retrieved 48 articles between 1977 and 2015, and in around renal, a combination of terminologies were inserted, and this retrieved 24 articles between 1989 and 2015. In around leadership and management, a combination of terminologies, had retrieved 291 papers between 1977 and 2015. Now, these were sort of the number of publications or peer-reviewed papers or works identified through the basic search aspects in PubMed, or utilizing PubMed, the PubMed search engine. In around the advanced search, in around PubMed, using PubMed database, inserting all the words, and then selecting a title, abstract, and or option. This retrieved 28 articles between 1977 and 2015 under the blood sort of category. Under the renal category and the advanced search, is inserting all the words or terminologies and selecting title or abstract and or search option. This retrieved 24 articles, again between 1989 and 2015. In around the advanced search under leadership and management, inserting all the words and selecting title and or abstract and or search option. This retrieved 388 papers or publications between 1977 and 2015. So in around all of the categories, in around sort of renal, the blood, renal, and leadership and management sort of categories, another aspect around the categories was a refined search. The refined search highlighted under the blood category. The basis in around the refined search under the blood category was looking at sort of the adult population, looking at search, publications in the English language, looking at looking at the abstracts, sort of selecting the abstracts and the abstracts components within the database, and utilizing PubMed, but also sort of PubMed, PubMed or PubMed Central, but also the Medline subsets were also marked. This retrieved 20 articles between 1977 and 2015. In around the renal sort of refined search research, the the search the refined search included under the renal category the adult population, the sort of and all the all search aspect or component, looking at identifying papers or publications in the English language, looking at papers with abstracts, looking at marking Medline and PubMed central subsets within the refined search category in the renal under the renal category, and this retrieved 22 articles between 1989 and 2015. And in the refined search under the leadership and management, again, looking at papers or publications amongst the adult population, selecting the all search component, looking at papers in the English language, looking at papers amongst where papers had abstracts, and had papers or publications amongst the Medline and PubMed Central subsets, which were also marked. And this retrieved 98 abstracts between 1989 and 2015. In around the EBSCO-host database, the EBSCO-host database, the same grouping, the same categories had been utilized, except that specific further terminologies had been inserted in addition to some of the bases in around the PubMed, in around in around the sort of general where the general sort of grouping of terminologies under blood, renal, and leadership or management sort of categories. This included sort of the grouping of terminologies were blood and care, disease, leadership, and management. But the further terminologies included a sort of the adult population, transfusion care, red blood cells, and anemia, and in the disease category, and amongst the disease category or term around the disease category, the further sort of terminologies had been again the sort of those amongst the adult population, chronic illness, and long-term condition or long-term condition, and in amongst sort of leadership and management, so further terminologies including adults or the adult population, practice, research, and healthcare management. These were sort of further terminologies that were utilized as part of the EBSCO-host database, and explicit grouping of terminologies. Now, in around the themes and explicit number of papers identified or publications identified through both PubMed and EBSCO-host search and sort of databases. This will now be a part of a subsequent audio podcast. So that draws this audio podcast to a close, and this audio podcast as part of the Segmental Scruples series or edition, this audio podcast as part of a Rampage Sonar, this audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production.